Amiga, do you ever feel caught between two worlds? You cherish your cultural background, but sometimes it clashes with the realities of raising a family in modern America. You might feel pressured to fulfill traditional expectations, yet you crave a life that allows you to be your true, authentic self. If you're a Latina mom nodding your head right now, I see you, and I get it. Balanced Motherhood is more than your average mommy coaching program. It's a supportive comunidad designed specifically for you. I understand the unique challenges you face navigating between generations and culturas while forging your own path as a mama. Stop feeling like you have to choose between your roots and your future. Balanced Motherhood empowers you to create a life that celebrates your heritage, embraces your motherhood journey, and prioritizes your own happiness. Spots are limited. Don't miss out on this opportunity to connect with a supportive community and create a more balanced life. Visit the link in the show notes to join the waitlist for the next Balanced Motherhood cohort. I can't wait to meet you. Hola, hola, amiga. Were you ever told that it is totally normal to pee once you have a baby? Have you ever wondered why there are so many common misconceptions about pelvic floor health for women? Well, I am excited to give you a quick introduction about pelvic health because there are so many benefits that pelvic floor physical therapy can do for you and your changing body, especially when you become pregnant and have a baby. Today we welcome Jessica Kerr, who is a licensed doctor of physical therapy and founder of Allied Therapy Partners. Jessica is skilled in working with individuals with pelvic floor dysfunction or those who are pregnant or postpartum. She is a trained Herman and Wallace pelvic health provider and obtained her certification as a pregnancy and postpartum corrective exercise specialist. During my first pregnancy, I had no idea there was physical therapy for your pelvic floor, and if it wasn't for my mom friend who told me about this, I wouldn't have known about the amazing benefits there are. At the time of the recording with Jessica, I was 36 weeks pregnant, and I had just started to go with a pelvic floor physical therapist. Since then, I had continued on going to physical therapy, and now that I am 3 months postpartum, I can tell you that I feel a lot different. I feel stronger. My core feels like it has rehabilitated much quicker this time around with my second pregnancy than my first. I hope you leave with so much wisdom after listening to this episode about pelvic floor health, because oftentimes in our comunidad, we don't talk about our bodies as it is. And so if there is no connection that we have with our bodies, how are we supposed to articulate and talk about any issues that may occur, whether if it's during pregnancy or postpartum or even menopause? And so this conversation will give you an overview about pelvic floor health. However, my intention in a future episode is to focus more so on pregnancy and postpartum, because for me personally, that made such a big impact. So if you have any questions as to what you'd like to know about pelvic floor health as it relates to pregnancy and postpartum, let me know. Send me a DM on Instagram at Viva La Mami, or send me an email, which is podcast@vivalamami.com. And that way I can have another future episode with Jessica Kerr. But in the meantime, here's my conversation with Jessica as we talk about why pelvic floor health matters for Latina women. Welcome to the Viva La Mami podcast. I am your host, Jessica Cuevas. I am a mother of two on a mission to help redefine the meaning of motherhood as a modern Latina mom. Motherhood can be a complex journey, interwoven in two identities that often make us feel ni de aquí ni de allá. Viva La Mami is committed to providing you with knowledge, tools, and support to navigate the challenges and triumphs of motherhood as Latina moms. On the show, we'll be discussing culturally relevant topics that will help inform and empower you in whichever season you are in on your motherhood journey. We'll be joined by Latina moms, experts and professionals who can offer advice, practical tips, relatable stories, and honest conversations. So bring your cafecito as I invite you to be a part of this space as we create comunidad about the exciting and challenging parts of being a mommy. Ahora, vámonos. Hola, hola, Jessica. How are you?
I'm good. Hola, ¿cómo estás, Jessica? Two
Bien.
Jessicas.
I know, we're tocayas, like how people say. Very
Yes,
popular
we
name.
are.
Thank you so much for being here. I really appreciate it because I think it's about time that we just talk about our bodies and our pelvic floor health. And I'm very excited for you to be here. So thank you so much.
Thank you for having me. I'm so excited to talk about pelvic floor stuff because it's my favorite thing to talk about.
Yes, yeah. So before we delve into the conversation, can you tell our listeners more about yourself as far as with where you're from, your family, and also what you do now?
Sure. So I am Jessica Kerr. I was born in Chicago, but my parents are originally from Bogota, Colombia. So they are Colombianos. So I'm first generation Colombian American living here in the United States. And we grew up in Chicago until I was like 7, and then we moved up to the suburbs, as many people do, sadly, because I love Chicago. And so now I live in Chicago because I came back to the city, and I am the owner of a private practice called Allied Therapy Partners. It's me and a business partner, and I specialize in pelvic health. And so I work in the pelvic health specialty in physical therapy. So I'm a doctor of physical therapy, and then my specialty is pelvic health.
Yeah, that's awesome. And I would have to say that as far as with representation within this particular field, it is so scarce, especially, with Latina women. So I just want to kind of
Mm-hmm.
point that out there. Thank you for what you're doing. I know that it can also be taxing as like one of the few, right, who are practicing in this field, but it is much
Yeah.
needed.
Yeah, sadly, physical therapy there's very little people of color and ethnicities in the field of physical therapy. So there was one other Latino in my program, and I think he was Puerto Rican. But that was it. It was just me and him out of 60 people. So,
Wow. Yeah. Yeah, it's interesting how that can make an impact
yeah.
too. Yeah, well, kind of before we talk more about just all of the things that I kind of prepared in this interview because I have so many questions, can you kind of give us a quick anatomy lesson? Can you explain to us what is the pelvic floor?
Sure. So the pelvic floor is 3 layers of muscle that sit at the base of your pelvis. So if you think about your pelvis, you have your 2 hip bones on the side, right? And then the base of your pelvis. So that would be like where your poo and your pee comes out of, because we're going to talk a lot about poo and pee. And so right there at the base of that area, that is where your pelvic floor muscles sit.
Mm.
So they sit at the bottom, and they're basically the bottom. They're basically like the basement of your whole abdominal cavity.
So it's all connected from the very top.
Yes, yeah. So the diaphragm creates the top of your abdominal cavity, and then the pelvic floor muscles are like a sling or like a trampoline of muscles that sit at the bottom of your abdominal cavity. So above your pelvic floor muscles would be like your bladder, your uterus, your ovaries, all of that, your colon. So that would all sit above your pelvic floor. So beyond your pelvic floor is all of the external genitalia that you see. So like the vulva, for example, that is all part of the pelvic floor. It's all external skin to the pelvic floor region.
Interesting.
Yeah.
Okay, you literally visualize it so well.
Oh, thanks.
Even for the listeners, I'm pretty sure that they got it. But yeah, it is interesting how it's kind of like a sack then. Like that's how I'm envisioning it. Like a hammock that holds all of these like very important organs of your body. And so in terms of like understanding your pelvic floor and everything, at what age should they really start thinking about their pelvic floor health? And then during what stages of a woman's life would you recommend seeking a pelvic floor specialist?
Sure. So let's kind of take a step back to like what the pelvic floor even does.
Yeah.
So the pelvic floor itself is a group of muscles, and the pelvic floor acts, like you said it, like a hammock. It helps support all of our like internal abdominal organs. And so that's why it's important that the muscles be strong so that it can help support all of those organs up. And so just a few other functions of the pelvic floor are its relationship that it has with your diaphragm and your core. So like the muscles surrounding your abdomen. So you can think about like your abs and like your oblique muscles. So if someone has like a six pack, you're looking at their abs in the front. If someone has obliques, you're looking at the muscles on the sides of their trunk. And then also a deeper core muscle called your transversus abdominis muscle. So the core muscles all work together with your diaphragm and your pelvic floor to help you with your mechanics of breathing. And so the pelvic floor also helps you manage pressure within your abdominal cavity along with the diaphragm and with your deep core muscles. So it almost acts like a piston with all of those, your diaphragm and your core muscles, to help you manage large pressure increases within your abdomen. So that's kind of like an interesting fact about the pelvic floor that a lot of people don't really realize. And so, for example, patients that have like prolapse symptoms, so that would be like if the pelvic organs are coming out of the vaginal canal or of the rectum, that would be like a prolapse. Those are all pressure related issues that would involve the pelvic floor. Or if you think about somebody that maybe had diastasis after pregnancy, so that is just an increased space between the two ab muscles, which is very common after pregnancy. That is also something that could be affected by a poor pressure management system within your abdominal cavity. So pressure management is one of the biggest things that I work on with patients as it relates to the pelvic floor, is getting that pressure management system back to what it should be so that a patient doesn't have symptoms. And then also the pelvic floor helps with sexual function in that it helps bring blood flow to the area. It helps with like sexual stimulation. It helps with like opening and closing of orifices. So when we poo or when we pee, things need to loosen so that we can open. Or sometimes, for example, for victims of sexual trauma, they might have the opposite happen, and they might have, and not just victims of sexual trauma, just some people just have tight pelvic floors. And so in those cases, their muscles might be tighter and might not be loosening and opening as much as they should.
Gotcha.
So there's a lot. There's a lot
Yeah.
going on with the pelvic floor.
Yeah. And it seems like, perhaps depending on the stage of your life that you're in, it can
Mm-hmm.
make an impact, or there may be some certain nuances, right? And that's kind of like my understanding of it. Like there may be some like specific issues that either relate to your age or to like a different moment of your life. This could even be like sexual trauma or giving
Right.
birth.
Mm-hmm.
Yeah. And how that can affect your body, which is
Right.
interesting. Yeah.
And so I know you had asked the question, at what age should women start thinking about the pelvic floor? So, like, everyone has a pelvic floor, even infants and toddlers and little kids and teenagers. Like, everyone has a pelvic floor.
Mm-hmm.
So there are pelvic floor specialists that will work with kids. And usually that is around urinary incontinence, constipation, like those types of conditions. So it just really depends. Any type of like symptom relating to something with your pelvic floor. So that could be pain in your pelvic area, that could be not being able to control your bladder or not being able to control your bowel movement. So like accidentally pooping yourself or anything like that, that is all considered a pelvic floor thing. And so sometimes that will occur in children. And so that is a possibility for a child to be seeing a pelvic floor specialist as well. So it spans across the entire lifespan. So I wouldn't say there's really any specific age. I think most people tend to follow up with pelvic floor PT when they're pregnant or when they're postpartum. But I will say that the number one cause of nursing home admissions in the United States is due to bowel and bladder incontinence. So that would be just people not being able to really control their bladder or their bowels. So that is why pelvic floor health is so important, because it can really mean the difference between you having to get admitted into a nursing home versus not later on in your life.
Yeah. And so to avoid that, like, when do you recommend people seek a pelvic floor specialist? Like, it doesn't matter, like, regardless if you give birth or not for females, or what are
Yeah,
your
so
thoughts?
there is a protocol that I like to follow called the Cozian protocol. And so there's very specific kind of like things on this protocol. So some of the questions on the protocol, this is like a very general screen. So these are reasons why somebody would seek a pelvic floor physical therapist, regardless of age. And so having any sort of pelvic pain in the genitals, in the perineum, in the pubic area or the bladder area, or having any sort of pain with urination that is more than a 3 out of like a 0 to 10 scale, that would be a reason. Anyone who has had any sort of fall onto their tailbone, their lower back, or their butt, even if they were a child when that happened. Anyone who experiences any sort of like loss of urine, not being able to completely empty their bladder, having to pee a few minutes after all having just peed, any sort of like pain or burning with urination, any sort of difficulty starting or stopping your urine stream. And then in regards to bowel symptoms, any sort of like loss of bowel control, not being able to completely empty bowel movements, any sort of straining or pain when having a bowel movement, or difficulty initiating a bowel movement. Also having to get up 2 or more times at night, having feelings of increased pelvic pressure or feeling like your pelvic organs are slipping down or falling out, having a history of low back pain, hip pain, groin pain, tailbone pain, or even patients that say they have sciatica, that would be a reason to see a pelvic floor PT. Experiencing any sort of like pain or discomfort with sexual activity, penetration, or even intercourse, or if sexual activity increases any of the symptoms, and then if prolonged sitting increases any of the symptoms. So from all of those, if someone checks 3 or more, then it's likely that pelvic floor dysfunction is likely. And so, and a lot of those, like, you wouldn't even think about, like, a lot of people have hip pain forever and ever and ever. Or some people that I work with will say, I've had low back pain for 5 years and I've seen 3 PTs. And did you ever see a pelvic floor PT? No, I didn't. And then sometimes we can recreate that same low back pain with doing like trigger point, or like even just putting pressure on certain areas of the pelvic floor internally. And a lot of times that happens like more times than I can even tell you, but like I'll work with a patient, they'll say I've had back pain forever, and then we're able to reproduce that pain from an internal like standpoint. Wow. From me just working on their pelvic floor. And then they're like, wow, like I had no idea. And so the thing to think about with that is that the pelvic floor attaches to the base of the spine, and it attaches like all through the pelvis, which is really close to your hips. So that's why hip pain, tailbone pain, low back pain, all of that can easily be caused by any sort of like tightness in your pelvic floor. So just a cool thing that I always love to talk about is that those are all symptoms of pelvic floor dysfunction.
Yeah. I'm pretty sure that many people would say that, oh, crap, like, I think I need to seek a pelvic floor PT. considering that the list is really long. And I'm sure many folks will be like, well, yes, I'm checking these boxes and that's me. And so, why do you think people don't seek a pelvic floor specialist? And especially in the context of like the Latinx community as well.
I think people just don't really know about it that much.
Mm-hmm.
I will often meet people that are like, I had no idea that you even existed, or I had no idea that this was common and that it was like okay to go see a pelvic floor PT.
Mm-hmm.
And I think in general, I don't know about you, but when I grew up, we did not talk about, we weren't walking around talking about, hey, my vulva looks like this. Or, my brother wasn't walking around saying, my penis looks like this. And so, like, anytime we talked about anything like that, my parents were like, no, like you're going to get the belt. And so, no, we don't talk about that.
Mm-hmm.
So I think that has a lot to do with it within the Latino population, is that, the older generation Latinos are very conservative and they don't talk about that kind of stuff. Yeah. So it's just not something that's talked about. And in general, it's a very male dominated culture. And so because of that, like no one really cares about what the female is going through.
Yes.
So that's my opinion on that.
Yeah. And really, at least for me, like in my family, my family is like super dominated by women. But even though everyone talked about their bodies in a way, it's almost like their way of healing or working their bodies is by over medicating themselves and not really looking into like the therapeutic aspect of like fixing those issues.
Yeah, you're so right. And just to kind of go on that, so I do have a relative that is near and dear to my heart that was having pelvic organ prolapse. So one of their pelvic organs was like coming out of their vaginal canal. And so I accompanied this person I was just curious to see like, because this person doesn't really speak English very well. And so I just wanted to go as this person's like backup to make sure that they were, first of all, being treated fairly. And then just like wanting to know what's going on, because this person also doesn't quite understand like medical jargon. When physicians and doctors talk to them, they don't quite understand like what's going on half the time. And so I just wanted to be there. But anyway, so I went, and the physician didn't even mention pelvic floor PT once to them. And as a treatment for their pelvic organ prolapse, suggested that they sew their vagina shut. And I was like, okay, is that like even a thing? Is that like, and also I can't believe someone would even like recommend this to somebody. Like, and this is actually something that came out of this physician's mouth. And I was so appalled. And it was like really mortifying to me that this is like the advice that a physician is giving. And not everyone's like this, just this particular physician, but was actually telling a woman to sew her vagina shut.
Is that even legal?
And that was the advice. That was one of 3 solutions to the problem. So there was a hysterectomy was one of them. Then there was surgery, and then there was sew your vagina shut. And I was like, wow, okay, there's no pelvic floor PT there at all. What is happening here?
Yeah.
It was just baffling to me. But anyways, again, I also feel like there's a lot of disservice to the Latino community within the medical field as well. So I can go on and on and on about that. So
yeah.
And it's sad. It's really sad. It's really sad. But I think people are starting to do their own research now, and people are just becoming more aware of what's out there, and really starting to not trust, because the person that I accompanied to this appointment, they're also someone who is very hesitant to do anything themselves for their own like benefit. They will very much try to use medication whenever possible to try to like heal something.
Wow. I'm just mind blown with the type of option that they were given. And yeah, that is just not fair. Do you think that there are certain taboos or beliefs about pelvic health in general? Or do you think that it's not even like people aren't even aware of how interconnected it can be to like your organs, your nervous system, your skeletal system, and beyond. What are your thoughts on that?
Yeah, I mean, I would say one of the most common myths that I hear is that it's totally normal to um, like pee yourself after having a baby. That is not that is
Mm.
not normal in any way, shape, or form. And so that is something that I get told a lot. Like a lot of patients actually will go to their doctor and will talk to their doctor, and they'll be postpartum and they'll be like, oh, that's normal. That'll probably just work itself out. And so that's never normal. So I always say, if anyone, like, you shouldn't live your life peeing your pants, or like not being able to cough, sneeze, laugh, or like jump rope or any of that without having an accident. That's not normal. It's very common, but it's not normal. So I would say that's a pretty big myth of pelvic floor stuff. The other thing is, I always hear, oh, like if you just do a whole bunch of Kegels, then you won't have to see a pelvic floor PT and everything will be fine. And so that's another thing that I don't love to hear, because for someone that has pelvic floor tightness, a lot of Kegels could cause them to really flare up. Or even someone that has pelvic pain, a lot of Kegels could really cause them to flare up. And then there's been a few studies done recently. They would tell people to do a Kegel, and then 50% of them would actually do a Kegel incorrectly. And instead of contracting the muscle up, they would actually be bearing down, almost like they were pushing pee out or pushing poo out. And so they were actually doing the Kegel incorrectly. And so I think a lot of times, if you're pregnant or if you go see your OB with complaints about things, they might say, okay, well, do your Kegels, but like they don't actually tell you how to do a Kegel or like make sure you're doing it correctly. And so for someone that has like prolapse, that could be like a pretty big deal, or someone that has pelvic pain. So that's another myth that I think. Don't go and do a bunch of Kegels. You don't need to do a bunch of Kegels. That's where like being evaluated by a pelvic floor PT would be helpful, because they can actually assess like, what are you doing when you do a Kegel, and is a Kegel even really a thing that you should be doing or need to do?
Mm-hmm. And I'm pretty sure about like sex too, right? A lot of people are like, "Oh, well, it hurts," or it's normal that it hurts, and
Right. And no, it should not hurt.
it
It should not hurt.
shouldn't. Yeah. Yeah.
Um, so again, that's another thing that's common, but it's not normal. And so, because of the hormonal changes after having a baby, or even with menopause, tissues tend to just change a little bit. And then also there's a little bit more dryness. So there's definitely things that can be done from a pelvic health standpoint to help with that. But yeah, painful penetration is not normal. So
Yeah.
that is definitely something that a pelvic health PT can help with.
Yeah. What are some of the common pelvic floor disorders that you frequently see in your patients you want to speak about? That way it can bring awareness. And could any of those be prevented?
I would say the most common pelvic floor disorders that I see are urinary incontinence. So that would be like losing control of your bladder. And then also diastasis. And so that would be like just more space between your ab muscles, which is very common after pregnancy. A large percentage of people will have diastasis, and that tends to heal over time and does not require pelvic floor PT in a lot of cases. And then other pelvic floor disorders would be like pain with intercourse is another big one that I see. And then one thing that is getting a little bit more traction lately is people are starting to get referred more for like post C-section. So that is great, because people like C-section is still one of the few surgeries where physical therapy doesn't get recommended afterwards, which is baffling to me, because like it's a major abdominal surgery that cuts through like several layers of muscle and tissue and organs. So like, to me, it's just crazy that PT is not recommended after C-section. So that is something that I do recommend pelvic floor PT for afterwards, that no one really ever is told to get. So, and then what else? I would say And then just in general, like a lot of my patients just want to like feel stronger. You know, I get that a lot. Like they don't necessarily have any disorder per se, or their complaints are very mild, but they just want to like feel stronger through their core. And then some people have like pelvic pain in general that is not related. That is just has a variety of different causes.
Thanks for providing those issues because, yeah, like I think it can vary, right? And depending on the stage of your life too, like I'm sure that
Right.
it can all vary. Yeah. And so when it comes to like the different stages of your life, you know, of
Mm-hmm.
a woman's life specifically, I know that things change during puberty, things definitely change when you're pregnant and
Mm-hmm.
postpartum, and things change when you're in menopause. Can you explain to us really briefly why do our bodies change and like when is a really good time to really seek a pelvic floor specialist within those three stages?
The main driver to all of these changes is just a change in hormones. So
Mm.
hormones play a really big role in like our tissue quality, the way that our tissues react within our body. So for example, if you're looking at pregnancy, we get the relaxin hormone, which makes us super loosey goosey and chill. And so it also makes us extra stretchy because it has to allow us to let our pelvis open up to birth the baby, right? And so because of that, you know, joints just move a little bit more than they should and all of that kind of stuff. And
Mm.
so that also changes your body. Like your body has to go through changes during pregnancy in order to house a growing baby in your belly. And so with that comes changes in the length of all the muscles in your trunk. With it comes changes in your ribs and how your ribs are positioned within your body. There comes changes in like the position of the pelvis. I mean, it just like literally changes everything, pregnancy specifically. And then postpartum, the hormones, you know, they crash afterwards.
Yeah.
And then if somebody is still breastfeeding or pumping, they still will have higher levels of some of those hormones that still make them extra flexible. And so due to that, that could cause, you know, that could help to lead to some of the conditions like diastasis
Mm.
um, or like pelvic organ prolapse. If there's still a lot of those hormones in play, then that can make all of the tissues just a little bit more stretchy than they would be if those hormones weren't like in that stage. And then same with menopause. With menopause, there's a lot of, again, because of the hormonal changes in the tissues of our body. So, you know, we tend to get a little bit more dry. The tissues get a little bit more like, I don't even know how to say it, but just like rough. And so because of that, like some patients will say that they're having like more episodes of like painful intercourse during
Mm.
menopause and that sort of thing. And so yeah, really all of the bodily changes are really just driven by the hormonal changes during all of those different periods in time.
Hmm. Wow, that is so interesting.
Yeah. And so, you know, again, when do you seek a pelvic floor physical therapist? When do you not seek a pelvic floor
Mhm.
physical therapist? I always typically go back to that screening questionnaire
Mhm.
that we went over earlier. And if anyone has any of those on there, then that would be a reason. Or if anyone just has like a gut feeling that something's off with their pelvic health, like that's also a reason I think to go seek a pelvic floor
Mhm.
specialist.
Yeah. And so, kind of going off of that and thinking about equity, accessibility, and affordability, especially within our
Right.
community, are pelvic floor PTs like they be covered under insurance or does it depend on the
Yeah.
practice? Can you kind of tell us a little bit more about that?
Sure, yeah. So first I'll start by like how do you find a pelvic floor PT? So I
Yeah.
really like to use the Pelvic Guru website. And so I can send you a link for that in the
Mhm.
show notes. And so you can go on there and you can put in your location and then it will tell you like all of the pelvic health PTs in the area. The other thing to know is that like not all pelvic health PTs are created equal. Some have advanced training in like pregnancy pregnancy and postpartum. Some are trained in internal manual therapy where they can use tools or their hands to do more like manual techniques to the pelvic floor muscles internally. And then some are only externally trained. So if someone is looking for a pelvic health PT, I would always recommend someone who has had like more training in the field in terms of like being internally trained and then also being able to like specialize in a pregnancy or a postpartum if that's like what your thing is. Or if you're like a geriatric person who has urinary incontinence, then working with a pelvic floor PT that maybe specializes more in like working with the geriatric population, then that would be just something to consider. Because even though they're just not the same. So just something to think about. And then so PTs in general, it is a service that is covered by insurance. It just really depends on the insurance and whether the practice takes your insurance or not. So some practices take certain insurances and they might be out of network for other insurances. And so that will determine like what the financial responsibility is. And then some practices are cash pay. So that just means that they don't deal with any insurance companies at all. And then those patients usually pay cash for the service. And then sometimes they can still get reimbursed by their insurance company as like the practice being an out of network provider. So it really just depends.
Yeah.
Yeah.
Yeah. And I know, as with all therapy, we have to put ourselves forward with ensuring that we continue on with exercises and things like that. And I know that sometimes it cannot be so manageable, especially as women and as mothers, where we have like so many things going on. So what would you say to that? Like if someone puts in the excuse, well, I don't think I want to go to physical therapy because I'm busy as it is, like, what would you say to that?
Yeah. I mean, anytime you're making decisions about your health, you have to like, you're always weighing like, what do I prioritize in my life? Do I prioritize my health or do I prioritize this other thing? And so I think there's a lot of different types of practitioners out there. So there's pelvic health PTs that work like out of a hospital. There's pelvic health PTs that can see you over like a video, like telehealth. So that might kind of break the barrier of like, okay, maybe the person doesn't have transportation to get somewhere, or maybe they're like really busy and they only have like this short little 30-minute window of time, or they can't be driving around places. So telehealth is an option, and a lot of practitioners do offer telehealth. And then some practitioners will come to the house, which is what I do. And so I go and I see my patients in their home. So like, I don't care if their kid is there. I don't care if their dogs are there, needs to be fed, like whatever needs to happen just happens there in the house, and I'm fine with it. And so there's all different types of providers. But really, the patient has to want to be willing to get PT.
Yes. It's just like any other form of commitment, and
Yeah,
you got to put in the work so that you don't
you
end
do.
up getting surgery, right? Like a hysterectomy or something like that.
Yeah,
And
absolutely.
yeah.
And with physical therapy, there is like a little bit of work that you would need to do yourself. So a lot of the progress that is made within pelvic floor PT depends on the patient, and like, are they doing their exercises? Are they following through? Are they, trying to like take a step in the direction of changing their habits? And do they want to? Do they even want to? Some people don't, and that's fine. You can't force someone to prioritize that.
Right.
So yeah. And then some people, like, it's just not the right time for them. Like sometimes I'll get a patient that I'll work with, and then, they're kind of like plateauing and they're not really making a whole lot of progress after a certain point. And then maybe it's good for them to just like take a break for a little bit, and then come back to it when things in their life have settled down or things have changed, or maybe priorities have shifted. And now it's like more the time that they're willing to spend this time on themselves.
Yeah. Thanks for pointing that out there. And, kind of going back to our comunidad, how can we better educate ourselves about our own bodies so that we can recognize, how sometimes these symptoms are not normal, that we can then seek professional help.
Yeah, so like one thing that I've been doing in my own household is just like actually using the correct terminology for body parts with my daughter, for example, so that it's not like this, it's not like a private part, or it's not, like I want her to know what it is. I want her to know. And then I want her to talk like that to her friends too.
Yes.
So that's a big thing that I think that I've started to do in my own house, which was not done when I was a child. And so just starting to normalize it from like a very young age.
Mm-hmm.
And then the second thing is just talking about it more, like just talking about it to your friends more and just bringing those things up, right? Like, well, yeah, I pee when I laugh, or like just putting it out there more, not in a way that like, okay, it's normal to do that, but like, hey, it's really common and there's things that we can do so that that doesn't happen anymore.
Mm-hmm. Mm-hmm.
Yeah. So I would say those are really the main ones, is just bringing more awareness, talking about it more. And then like having it start with our kids. They're just a totally blank slate. And so they don't know what's socially acceptable and what's not socially acceptable. They just do it. And then based on how you react, that's how they know if something's acceptable or not. So, so yeah, that's what I think.
Yeah, thank you for sharing that. I have a 2-year-old, and since the beginning, we're like, we're gonna use the right words, not the los huevos or los huevitos, or like,
right. Yeah.
yeah. And that's something that I'm correcting my parents, because they're the ones that are, caregivers for him when we're at work. And I'm like, okay, we use this language. We're not sugarcoating. We're not like creating, like fluffy language just because he's young. That doesn't mean anything. Like, I want him to know his body and recognize that, like, it's normal. Like how you said, our kids are a fresh slate. And even for me, like, I think I'm the only one who has gone to like a pelvic floor specialist right now that I'm pregnant at this time. And I had no idea. If it wasn't for one of my like mom friends who also went with a pelvic floor PT, I had no idea that you get examined, down there. And when I told one of my other friends, she was like, "What? Is that what they do?" And I'm like, "Yeah, like they just want to see how like strong you are down there, I guess." And
Right.
and yeah, and so it's just a matter of bringing awareness and normalizing, these kinds of conversations, so that way you kind of have somewhat of like expectations without you feeling like, "Oh my gosh, am I going to be touched or whatever?" um
Yeah.
yeah, because that often makes people uncomfortable, and especially when it comes to like us Latinos, like de por sí we don't talk about our bodies and imagine someone else touching you, right? And so
Right. And
it
then that is a good point. That's something that we've actually realized that since opening our practice, that like sometimes people will like do the intake for pelvic floor PT. They'll be set up for their evaluation. They'll get to their evaluation, and then, we I'll always get consent, always explain thoroughly like what is going to happen here. And a lot of times that's the first time that someone like realizes what is going to happen during their evaluation. So, that we were thinking like maybe we should like do a video on our website just to like explain what to expect, so that that is not the first time like they'll come into the evaluation already seeing this video and like knowing what to expect. But because we have had like a few patients be like, I had no idea, like, and that's not what we want. Like, we don't want to catch our patients off guard either, like
right.
during our first session, so.
Yeah.
And they don't have to, like, patients don't have to have patients can have whatever they want to have. Like, if they don't want to have an internal exam, that's totally fine. If they don't want us to examine their genitalia, that's totally fine. It's like totally patient driven care. Whatever they want, we will work within their constraints on whatever they want. And so, but yeah, you're right. Like, a lot of people, I think, don't realize what it can mean.
Right.
So,
Well, so you're new as well into like motherhood. So I'd be curious what
yeah.
you would say. So the first question I have is, what still surprises you about being a mommy?
Just like the amount of time spent on mothering is still like, I don't know why I had this picture in my head. We're like, okay, I'm going to have my child. And then when they sleep through the night, then I'm going to be able to do all of the things again, you know, or like, and so just the amount of time that they really take, and it's not always bad. It's all beautiful stuff, like being able to see your child grow and stuff and do great things. But I feel like the lack of sleep and the amount of time that you actually spend on things for them compared to like the time that you spend on yourself, which is nothing.
Yes.
So that really surprises me, I think, still.
Yeah. Thanks for, saying that, because we are selfless individuals. Alrighty. Well, second question, what is one tip of advice you have for Latina mommies?
Yeah, so this is just from personal experience, but like, I feel like for me at least, growing up, we were like very much forced to like fit into this new culture and like lose a lot of our Latino heritage. And so me personally, I just feel like let's try to like bring it back. Let's really delve into our past. And it's just sad when I think back to like, I don't know a whole lot about like my ancestors in Colombia, for example, but I feel like, and then it's just going to die with me, So I feel like try to keep that going and try to bring back, at least talk about like your ancestors or look into your ancestors and like, I don't know. That's what I think for me. Like, for example, we chose a dual language school for my daughter, for my kindergartner, because like my husband doesn't speak Spanish. He's just an English speaker. So so I didn't want the language to die with us either. And I wanted to keep it going. So I think just whatever we can do to like keep it going, that's my advice.
Yes, absolutely.
Because it's hard. It really is hard as like a Latina here in the United States to keep it going.
Yes, absolutely. Yes.
So.
Great. All right. Well, final question. What is your meaning of motherhood?
I would say just the hood where we are just trying to make like little people's lives better than our lives were, and not that necessarily our lives were bad or anything like that. Just the whole act of us trying to make someone's life a little bit better than our life.
Yes.
So that's it, I think, for motherhood.
Yeah, that's a great answer. Thank you so much. Where can people follow you or visit, your practice for those that are in the Chicago area?
Sure. Yeah. So to learn more about the practice, they can check us out at alliedtherapypartners.com. So that's our website, and you can go on there and like get started for a pelvic health evaluation or ask questions, whatever you want. And then we also have an Instagram, which is Allied Therapy Partners, and then also a Facebook, which is also at Allied Therapy Partners. So all of those are good ways to contact us. And then my email address is Jessica Kerr, that's Kerr, at alliedtherapypartners.com. So that's another way that people can contact me.
Great. Yes. Well, Jessica, thank you so much for being here. I really appreciate it. And for you to share your expertise. Like I said, I've never met a pelvic floor PT who is Latina.
Hopefully there will be more.
I hope so too. Yes. Yes. Well, thank you so much for being here. I really appreciate it.
Thank you, Jessica.
Thank you for tuning in to the Viva la Mami podcast. If you like this episode, make sure to leave a review and write what episode really resonated with you. If you really loved it, share it on social media or with an amiga. As always, please subscribe to this podcast wherever you are listening. Make sure to follow me at Viva la Mami on Instagram or visit vivalamami.com. Please note the information shared in this podcast is for educational purposes only and should not be replaced by your healthcare provider nor taken as professional advice.